let's pick up with the panel. I think everybody now knows you, Ron, so we don't need an introduction from you. But let's start with you, Anya. Just briefly give an introduction of yourself and the company and what you do.
Okay, hello, I'm Anya van Balen. I'm a sector banker healthcare at ABN AMRO, which is a bank. And sector banker healthcare means being involved in all the strategic moves that the sector makes and the financing of the activities which are being done. And my core is mainly on financing the healthcare institutions, so the established institutions which run the intramural care. And I cooperate with people who are more at the investor side.
Great, thanks. Oh, sorry, no, go ahead, Anya.
That's it.
Great, thanks very much. Martin.
Good afternoon, everyone. My name is Dr. Martin Zarnowski. I'm an associate professor and also a researcher. During the last decade, we did many research with our partner here in the Central European region, specify the aging and the well-being and healthcare matters. And I appreciate you invite me to the program.
Great, thanks very much, Martin. Geert.
Yes, good afternoon, everybody. My name is Geert van der Heijden. I'm specialist healthcare at Rabobank. I'm involved with the portfolio for real estate, healthcare real estate and senior housing. Rabobank is a cooperative bank in the Netherlands, specialized in food, agricultural and healthcare.
Super, thanks very much. Alexander.
Hello, everybody. Good afternoon. My name is Alexander Watson. I work for Care Property Invest. It's a REIT in healthcare. I'm an acquisition manager. As you can see, I'm sitting in the car right now. I'm always on the road trying to find new opportunities for the company. I'm specialized in the Dutch market. At the moment, our company is investing in 3 countries, Belgium, Holland, and Spain. They're 3 completely different markets. It's a whole other ball game. It's very interesting to sort of see all these things come together. And I'm very glad to be part of the panel today. So looking forward to discuss a little bit about it.
Great, thanks. I mean, it'd be interesting just to pick up. I mean, it's interesting for me, certainly, because we've done a few sessions over the past couple of years looking at senior housing, healthcare, and also crossing over into that impact investment side. But it'd be interesting, maybe just starting with you, Anya, the impact investment side, senior housing, healthcare, I guess, what's your perspective on that, particularly the impact investment side, and I guess, you know, what's the vision of the company alongside that?
What do you mean by impact investing? Can you be a little bit clearer about that? Is that just a healthy environment or just having happy people?
Yeah, I mean, but well, I suppose creating a positive impact in terms of the investment that you're doing, that there's a strategy behind it, and certainly healthcare, senior living, in terms of improving people's lives, matches some of those impact things.
Okay, well, our view is that we do think there should be much more housing available for senior people. And that the housing also should be of good quality. And good quality is good environmental internally, but also on the energy transition and on the green impact we all try to have. So that's a sort of a double issue. We say, okay, we should have houses which are affordable. There should be housing and which do not have too much energy consumption. And which is very important, and where we always have to think about is there should be people to give the services. Because it's no good if you live somewhere if there's nobody to provide all the healthcare services with it. So when a proposal reaches us and people say, okay, we want to invest and we see a wonderful opportunity here, there's a huge gap in the market, and then we say, okay, so what's the type of property? How big are you going to build? Are going to buy? What's the rent going to be per month? Who can afford that? But also, what's the energy label? that you do have. And then the third question always is, who is the healthcare provider? And what does the GP in the region think about it? This has to be a match, because stones only is insufficient. And we have to have the feeling we're doing something for the better of the Netherlands, that it fits within our infrastructure and in the healthcare system we have. So whenever a proposal reaches my desk, you better beware. You'll get a huge amount of questions on other things as well. And then somewhere at the bottom, I look at the bar. I say, that's way too high. I want a social bar. 2% is enough. So at the bank, we really try to guide everyone on where to go, what to do. And I also think that investors can help the traditional department in the Netherlands, the traditional, I don't know the word, it's a stichting. They're not really keen on exploiting their real estate to the max. They are really keen on giving good services. And we now then say, come on, go and cooperate. There are other people who do this better. You are a beginner in this field. This is not your expert. So that's more or less it. That's how we look at it. And we find it very interesting that the investors also look at it. Nobody just reaches our desk and say, no, it's stones only, and shut up. That's where I want to keep it for the moment.
Great, thank you. And I'm obviously sharing moderation duties here. Ron has obviously stepped in to help me, which is great. But I just wanted to pick up with you first and jump in whenever you feel the need, Ron. I know that you will. I just wanted to pick up with you, Alexander, just picking up that point from Anya. You say there that you're obviously on the road a lot of the time looking at this. What's the criteria for you, I suppose, in terms of what you're looking for?
I think I can concur with most of Anya is saying. When I look at a project, we usually see 5 different objects. We have the professional who provides the healthcare. That's one party. You got to look at that party to be professional and to give the care that is needed at the home itself. We look at the clients that have the specific needs. And then you can break it more up into an investor point of view. And I look at projects as something you can sort of look at legally, financially, or technically. And I think investors and banks always in the past have looked at it more financially. As we look at prices that are being given today, they're sort of more or less based on bars, not really on what the things are that are behind it. I think in the future it will be more of a technical issue. A lot of what we're seeing as well is that at the moment it's becoming a more mature class of real estate, like for instance residential housing, but it's not. It's a completely different product. You need a lot of technical issues that you have to solve. So in that perspective, I think we will have to be more focused on technical stuff in the future, so that we can sort of provide the extra care that clients will need, also due to the fact that there is less staff that will be able to provide them with the needed care. So I think that is shifting, and it will become more and more clear in the next couple of years.
Oh, maybe Richard, additional question regarding the future demands of healthcare. I'm really proud of that Martin is amongst us. So Martin, you are quite renowned in terms of being professor and having a clear vision of friendly aging. So could you share us your insights regarding friendly aging?
Thanks, Ron. I think from a little bit from a bigger scale that from an economic approach, I think the basic fundamentals will remain. I mean, in this market, if we suppose that the demand-driven, the concept-driven, and the investment-driven strategies will remain in the future in this healthcare field. But what we have to focus on, especially from the financial side and the investment side, that many black swan events will happen. And this is not only one phenomenon, it's going to be faster and faster coming after each other. And the other perspective, what is not a new thing, and I think all of us understand that in the future, all stakeholders, I mean investors, operators, locals, they have to be involved in this investment class, because it could be also different effects. Let's say something that you may know, that there is a little bit a gap between the western part of the European Union or western countries and the eastern part. That that maybe we will discuss a little bit further on about insurance and any other things. But the thing is that we have to focus on, I mean, there are new possibilities in the Central European market side as well. And it's coming up in the next decade, definitely. And maybe it's much more than the Spain or the South regions. That's for now.
Yeah, and maybe a question also for Geert, because I think it could be very insightful to share your, well, maybe a brief update regarding the healthcare market, both on the cure and care side. So Geert, what's your update on the total market?
Yeah, for me, it's not only an update, but also a vision. What's a vision on healthcare in the future? And I think we are on the way to a caring community. The senior housing and the healthcare real estate of the future will be a part of the caring community. Participation, self-management and quality of life are central in the caring community, instead of living longer and focus on illness and care. Now, what does this mean for real estate? It means that vulnerable people, just like elderly, can live at home independently longer, and with support they can participate in society. So it results in more various real estate, like nursing homes, real estate for temporary care, real estate for all the people in the neighborhood, aimed at interaction. The result, the real estate has to be alternatively applicable in the center of the town or the village, sustainable, in close proximity to the facilities. And that's very difficult. And I'm agreeing with Martin that in order to create such a caring community, it's necessary that all relevant stakeholders start a local dialogue about future supply and demand for housing for the elderly and elderly care.
And maybe regarding the impact of COVID-19, when you, for example, look at healthcare operators, what's the impact, to your opinion?
In my opinion, there will be a more participation and self-management will be more relevant. Mm-hmm. And that means that real estate has to be more alternatively applicable, but also in the center of villages and towns.
That's interesting. I just wanted to pick up with you, Ron, just for a second. I mean, there's been a lot of discussion, particularly here in the UK, because of the deaths in care homes and a concern around the negative kind of impacts for that. But I think that's also brought out a discussion around what care homes should be doing, and also actually the modernization of the space and people re-looking at that. So it's interesting to see that there may be a positive part coming out of that. I just wondered what you'd been seeing both in the Dutch market, but also, I guess, across Europe.
Yeah, well, I think it's a relevant question. On one hand, of course, COVID-19 has a huge impact, especially on the personal perspective, because a lot of casualties were done, but also on the operators, it has an immense financial impact. Nevertheless, I think we are more and more aware that we should create state-of-the-art healthcare facilities. Also, for example, the installations of buildings are very important to be, to bounce back from the impact of COVID. So I think we are now aware that our facilities have to be state of the art, and it's very important to react directly on the impact of an epidemic. But I'm positive because I think now we've got a focus on the relevance of healthcare real estate, and also from an investor perspective. I think more and more investors are willing to invest in healthcare because it's a resilient asset class. So I think we will see a shift from the more traditional asset classes like offices, retail, maybe also residential, towards these alternatives. And I think especially also the impact side, I already highlighted in my keynote presentation that healthcare real estate ticks all the boxes on impact investing, and it's getting more and more important.
Yeah, and there's also a lot of money in the market from banks, but also from investors at the moment.
Absolutely. Well, maybe therefore also a question, because I'm very delighted that I think it's the first expert panel where we combine operator perspective, but also with investors and banks. And I'm actually quite interested, for example, Anja, what's your opinion about the cooperation between operators, banks and investors?
Well, in theory, that's always smooth, of course. It should be smooth.
Yeah.
So now, yeah.
Now the next step.
And now the next
Towards
step,
reality.
how do we get to reality? How do we get about it? In all honesty, we also have only a limited view as a bank on what an operator does and can do and has to do. But so we do check around and we do ask what they are. And so their image is very important. If there's any negative press, there's huge talks in town, and that's called Follow the Money research on healthcare operators who do cash the money from the from the insurers' premiums, but do not deliver any care. That's the main issue for the insurers on finding out who are reliable. And what we do, we really want to know who are there, what are there, and if there's a very good cooperation, and when also the real estate is nicely brought up to standards in the energy transition, then we say, okay, for this housing might be 5 or 10% more expensive than normally, but we have what we call a green envelope. We can say, okay, just because you're doing so well, and this is a social transition for having people living more happily in an energy sufficient house and careful attention, then we might just bend our rules a little to make this possible. Because we do think we all have to be in there. So that's the way we look at it. But in all honesty, I have not found so many of those yet, because a lot of the investments we see are for the upper markets, whereas the largest demand is for a little over social housing, something like 1,500 in rent. And we also notice that there's a transition we as people have to make. We as a people have to accept that when you're 75, you move out of your normal house and you go to another house and start or buy it or pay rent. And so you do not get in such houses by the time you're just an inch away from death, which is what's happening now. Everybody is staying at home to the very last bit, and all the kids say, Mom, Dad, we can't manage it anymore. It's just too difficult. And then you go to a health provider, to an operator, and they say, whoa, you are really ill. And so we also have to make this social transition ourselves, and that we can, that we do not move at the very, very last moment. And I think that's that's a move we're all making, and we see social projects popping up in the Netherlands also for people who want to live together and also care for each other, and we happily support those. So yes, we're willing to do more, but it also has to be for the mid-market then.
Yeah. Well, maybe Richard also, I think it's relevant, next question for Martin, because of course, I think the CEE has its own challenges. So do you recognize this clear vision of Anja, which is more like the European countries like Belgium, Netherlands, UK, Nordics? Do you see the same challenges in the CEE?
I think I can partly agree with Anja. Of course, sustainability is a key issue completely, but there are other challenges in Europe. Let's say that, when we are talking about healthcare, we have some cultural understanding phenomena with some negative issues that even if you want to take the same service in different countries in the European, there might be a slightly change. This is one issue what we have to work on a little bit. Another issue that we beat the aging phenomenon, that is going to be also a serious wealth issue to the younger generation. And it's very, very important, especially from the financial investment side, reaching this young generation, because the young generation, believe me or not, it doesn't matter we are in the Central European or Western European location, they want to invest in their future. So they have a responsibility in the future. So I think this is the right time to invest in the long term, especially in the healthcare. And that's why I really support Ivo, because he does a phenomenal and fantastic job in this field.
Great, thanks very much. I just wanted to come to you, Alexander, just in terms of geographical diversification and opportunities, what are you seeing there?
Well, they're completely different markets. So we're spread over 3 different markets. The market that Anja is describing for me is specifically the Dutch market. I don't really have the same sentiment for the Belgian market, but it's more or less the same as population. We have the same life standard as the Dutch people. But the thing in Holland is, of course, you had this legislation that changed a couple of years ago and made it for the first time profitable for private players to also start emerging in the Dutch market. Now, these private players aren't as mature as in Belgium. In Belgium, we have a couple of very big players that provide healthcare. In Holland, everybody's still looking to expand. I can also agree with Anja that there's a lot of people there that will sort of change in the time that the Dutch market will become more mature. So that's the Dutch market. Spain is also a completely different market again. So in investment opportunities, I think by diversifying to different countries as an investor, it allows you to sort of look at the certain projects you want to buy as an investor, because we also have a strategy and a vision. And if you stay in just one market or 2 markets, you will start buying everything you'll find. And that's not the right way to look at it. So you need to diversify, and I think even more countries should be added to our portfolio in the near future in order to do so.
Well, I think it's a great vision, Alexander. Maybe an additional question from my side, and also regarding diversification, because you have a clear vision about geographical diversification. But what about the more asset class diversification? Do you think investors will also enter the mental market, mental care, or also the hospital care in the near future?
Well, that is, in my opinion, because there's too much money in the market due to our monetary system at the moment. People are looking for each type of class to invest in. I also think that today people are investing too quickly and too much money in certain markets that are still unstable. So yes, I think there will be more diversification just because we have no alternatives to invest in anymore, or less than we used to.
And do you also think that, for example, the Baltics or CEE will also be investable in the near future?
Well, they're smaller markets. That's the thing that is keeping big investors away. But I also think they're becoming more richer countries, if I can say it like that. And in the near future, they will also will be part of analysis to sort of invest there. But at the moment, people are focusing more on the bigger markets because it's easier to find a lot of product, if I can name it like that. And the product is less in these sort of countries. So I think we're still waiting for these countries to expand in senior healthcare before you actually want to look into that.
Good. I wanted to pick up, and this is really a question for anybody who wants to pick it up, but it's come through in some of the other discussions we've had, which is around resilience, especially, but also adaptability. We've had this a lot in terms of when we've been discussing student housing and the changeover there, where people are looking at different types of housing. So rather than it being communal living, people are looking for private bathrooms, private kitchens, those kinds of things. Obviously, in this sector, is adaptability going to be one of the things that's going to be key going forward, so that then we can address kind of these issues, or do we see really this kind of health crisis as a one-off? What's our view on that? If anybody wants to pick it up.
Well, if I may still, because I talk a lot to healthcare professionals, and the thing is, when I go to the board and I sort of describe a building we're going to buy, one of the things we want is a separate bathroom. Separate kitchens are also very welcome. So we're always looking for these type of real estate investments that have all these separate needs. When I go to the healthcare professional, and if I can join Anja again, that are usually have clients today that are very old in the last couple of years or months that they're still around, they all have a separate bathroom, but hardly anybody's using them because they're no longer able to use it, and the healthcare staff uses the big bathrooms that are sort of in the hallway and that are applied to everybody. So you've got a mismatch between what we think is right in the market, and on the other side, what is actually needed in the market. There's a big split between those.
And do you think this? And again, this is for anybody. I mean, we had a discussion yesterday, which was on the US market, and there was a lot of discussion there about multifamily, which is obviously very big, and the residential side here in Europe beginning to move a little bit more toward that kind of that element. And also, obviously, there in the US, you've got a very strong, investment product, which is senior housing. Is this a part of just the gradual maturing, not just of the sector here, but actually also of the demand, like Anja said there, that we've got to actually start to educate people in a way that there's a different way of dealing with senior living, which is more enjoyable, because if you can create the right kind of, the right kind of space.
If I may, just to say something that I agree with Alexander, because the circumstances, the facilities, the basic services are very, very important. But as you said, we had also previous research in the United States and in Canada, and we discovered that even from that market, the North American standards, there is a key factor. What is missing from that market is the human touch. So the people here in Europe, they are willing to pay more for the better care for their own happiness, instead of just having one extra bathroom or extra kitchen.
Yeah, it also means the quality of life, and I think it makes the quality of life better to have such kind of apartment.
Okay, good. And we've only got a couple of minutes left. It seems to have gone incredibly quickly. Ron, are there a couple of things that maybe you want to just pick up as a final round for everybody, just in terms of, I guess, how we see the market developing from here going forward?
Yeah, well, maybe one question from an investor perspective. So, Alexander, what's your opinion about mixed use?
That's a very good question because it's still one that I'm asking myself. For investors and bankers, it doesn't fit the ticking the boxes at the moment to invest. You're gonna have to think outside the box before these sort of mixed uses can come to an investor, because you have different groups that sort of have to collide with each other. For the investor, it's not clear who's going to be the tenant. So there's a lot of questions there. We are thinking we are companies that still have to rethink our complete system in order to be able to invest in such a mixed use concept. But I do think it will be the future.
Yeah. And maybe, Richard, I would like to ask a question to the banks, because I think making the next steps towards being Paris proof is very important. So what's the opinion of the banks of the Paris proof targets? Are we able to get these, getting close to the finish, or will it be very difficult?
I think there had to be a lot to do to make healthcare real estate at the moment sustainable, but new projects, they are all sustainable and Paris proof, but there is a lot of old real estate that has to be renewed.
And Anja?
It's going to be tough. And we are pushing on kind of educating the healthcare people on what they could do, because everybody always sees the problems and the no's, because they do want to focus on care, and then say, oh boy, this is so difficult, let's just put this aside. But when you really start looking at it, and what kind of building do you have, how can you use it differently, how can you have more efficient walking or your lights or whatever, you do see that you can get to a sort of 30-40% reduction, which is worth the trouble. People sort of blinded by, oh, I don't reach 100%. Well, just put it in the basket and ditch it. And when we can make 40% and you really strip two old buildings where you can do nothing about, because they were built in the 60s when gas in Holland was just discovered and considered for free and not important, then you can change. And then indeed, as mentioned, then the new buildings, they are bang. So that's okay. And then you can middle it out. You don't have to get each and every building on zero yet. Yeah. So we are working hard at it, but I have to admit, it's not that my desk is covered with files requesting for financing. So we are at the start still.
And maybe one final question and also a short answer from Martin, because how many time will it take that CEE is investable from a healthcare perspective?
I think there are some private players on the market, and they are focusing on specializing in special healthcare, like dementia or different issues, and this is the key. I think Alexander will surprise in the near future that we are just at the right time to invest in this region, because the people they are willing to invest in their happiness, in their future, and in their well-being.
Yeah.
That's super. Oh, sorry, Alex, did you want to pick that up?
No, I agree. So.
Great. Well, I will, on that note of agreement, we've run out of time, sadly. Thanks very much for sharing your insights with us in that panel. Really interesting. Great to get a variety, as Ron said, of investors, operators and banks all together to discuss that. And that's part of the remit, really, of the Senior Housing and Healthcare Association, to try and bring people together and actually promote this particular sector and also the impact investment side.